Retinopathy of prematurity is one of the main causes of visual impairment on premature infants. An early diagnosis of the ROP stage and the progress of the disease is essential to draw the right conclusions and initiate appropriate treatment steps. Today, the training possibilities are usually insufficient because the residents, they usually train on the patients themselves. But the problem is that this examination has to be carried out very quickly and very skillfully. There's a lot of stress on the infant and it can lead to a reduced heart rhythm, and then we have risky situations. So the Eyesi Indirect ROP is an augmented reality simulator, which means that as soon as you put the indirect ophthalmoscope on, you will see a virtual patient, in this case an infant, but you will also see your own hands interacting with the interfaces. You have an instrument that you can use on the infant. You also have haptic feedback here because we're talking about a real interface. So you can use the instrument to manipulate the eye and, for example, tilt it to one direction and then take a look with indirect ophthalmoscope so that you can really go to the periphery of the eye. The simulator has a built-in curriculum that basically starts with the device handling. So, for example, in this case, being able to screen the retina of an infant in this stressful situation. So there are different abstract objects on the retina that a trainee has to search and find with the device. There are 2 tiers within the curriculum that make sure that you understand how a certain stage of ROP looks like, and then afterwards to evaluate an unknown case, so to classify this case. So we're talking here about the learning mode of classifications and an exam mode. So in the learning mode, the simulator will tell you what you're looking at. You're looking at a ROP stage of this classification, you see how it looks like, and you will see the different stages of it. But then in the exam mode, the simulator will challenge you with an unknown case, and you have to introduce your findings, you have to introduce your classification and give your feedback about it.